My question is, does the Minister believe that Māori inequities exist in the current health system? If so, what data are you monitoring to address it, and will it be published?
Well, the reality is that the life expectancy for Māori is much lower than it is for non-Māori. There is a range of statistics which demonstrate that, and there's also a range of statistics which we measure in regards to our health targets and health delivery to ensure that we are ensuring equal access for patients to care and also improving health outcomes for all New Zealanders, including Māori. And so if you look at our health targets, for instance, one of the things that is done is we publish the data at a national level. We also publish the data based upon a range of ethnic breakdowns as well, including Māori, in order to provide that transparency around the outcomes for both Māori, the population at large, other breakdowns as well. And I think Health New Zealand's looking at also shortly breaking that down based on rurality versus urban as well. We've just applied I think, the rurality indicator to a lot of the health data this year. And I think that's going to provide another angle which we can look at our health target data.
To paraphrase, I think the Minister has said yes, that you acknowledge there are Māori inequities in the health system,
Yes.
and you are monitoring data to address this.
Correct.
And that data will be publicly published or available.
Yes.
And then my next follow-up is then what equity audits, binding accountability mechanisms and remediation plans are currently in place? Get that these are data sets that have been created. There's some that actually already existed. How are you ongoing addressing these inequities so they're not accumulating and getting worse under your watch?
Well, there's a range of initiatives underway to make sure that we are focused on ensuring all New Zealanders have access to the healthcare that they need. The data is critically important to ensure that. Can
I just do a point of order?
Well, of course you can. You can raise a point of order at any time.
I get it, and get that everyone are all New Zealanders. Is there some reason why we're not allowed to say Māori inequities or address Māori
What's the point of
in
order?
health?
I don't believe
Well, that's the point of order. My question is specifically dealing with Māori inequities, and I'm not asking about all New Zealanders on the basis that Māori inequities are very high and they die 7 years earlier than every other New Zealander.
Let's have some order here, Debbie. Thank you.
Yeah, the first point I made.
It's not a point of order. You can ask it as a sub.
I mean, the first point I made is I acknowledged that there is a significant difference in the age disparity of or the expected life expectancy of Māori versus the population as a whole.
And their experience in the health system.
And I acknowledge that as part of the first part of my answer. We need to improve access for all New Zealanders, including Māori, and that's what we've got the health targets in place to do, to ensure that all New Zealanders, including Māori, have that access. There are too many New Zealanders waiting for care, including too many Māori. We have to make sure we're focused on reducing wait lists. We have to reduce wait times. We have to improve access in districts and regions across New Zealand. The data helps us to highlight where the gaps are and where the effort is required in order to achieve reductions in wait times, reduction in the wait lists, and improving access to care. And that is a real focus, and that is why we've re-established the health targets to help focus the system on delivery for patients.
So to clarify, I'm sorry, the audits are, you have a list. Is that the formal way that the Minister is addressing equity? And I guess my question was, what equity audits, binding accountability mechanisms and remediation plans are currently in place?
Well, there's a range of initiatives underway. The Holder Māori appropriation is reported on in the annual report in terms of the outcomes, a range of outcome measures for Māori. But what I've sought to, and that is a clear accountability mechanism. What I've also sought to outline, though, is that we are applying a range of different lenses to the targets and to other data points in order to be able to provide transparency and accountability so that we can see where the gaps are and where there is a need to address them. One of the examples has been the focus on the immunising our tamariki work program, which was spoken about earlier by Dr. Nick Chamberlain. That's very much focused on how do we address the gaps in immunisation rates in our Māori communities. So there are clear focus areas that we have underway to address those gaps, and there's also clear focus on making sure that the accountability mechanisms also are able to provide transparent and accountable data so that people are able to see where those gaps are.
My final sup on this primary, please, is then how does the minister explain slashing Māori health providers by 750 million? If the focus, which leaves them about 38 million, if the focus is indeed on addressing Māori inequities?
Well, the government was elected not to continue with a co-governed health service.
With all respect, I understand that, but that's not the question.
Well, I'm outlining the answer to your question. We were elected not to have a co-governed health service. We were elected to have a singular health service for all New Zealanders, which is focused on improving access for all New Zealanders and addressing health based on need. That is exactly what we are doing. There is an appropriation for Hauora Māori services, which is used to address many of those needs, and there's a significant focus on that. But as I said, we have a focus on addressing health need in this country. Much of that need is amongst our Māori populations, and in the districts which we have higher Māori populations, that is where that focuses on reducing wait lists, reducing wait times, improving access to care, and working with Hauora Māori providers to be able to close those gaps and increase access for all
With a much
all
reduced
patients,
budget.
including Māori.